sensory crossing fibers?
Sensory crossing fibers.
I think it was, I don't want to say neural levels. I can figure it out. I'll look at it after.
Well, it was based on the beginning introduction about how the nervous system is put together, first of all, by segments, each with a sensory, motor, and association plate, which are ipsilateral. And of course, you all know that the brain controls the opposite side of the body, so at some point there's a crossing. But that's not the crossing I'm talking about. You don't have to remember the question.
No, I wasn't here for the question.
And so the question was, what are the exceptions, if any, to this general rule that the segmental apparatus is ipsilateral and the suprasegmental apparatus contralateral? It's the forebrain, mostly. So that was going to be a take-home exercise in discovery.
Well, the cerebellum is ipsilateral.
As related to the crossing of primary sensory and/or final motor neurons, that is the segmental, strictly segmental apparatus. And I think you'll recall from last time that there is one major exception to the sensory plate, derived from neural crest and migrating out as dorsal ganglia. One major exception to that is what's necessary trigeminal nucleus, the primary sensory neuron, the muscle spindle, the jaw segment, which lies inside the central nervous system, the one connected to the aqueduct midbrain. So that's the only exception that we have for the sensory plate, and its location being outside of the central nervous system. We do have one major exception, and a minor exception related to it, and that is the fourth cranial nerve, which is completely crossed. Its nucleus nerve goes back around the aqueduct, out to the side, forward. Move that backwards, make a big circuit. It is completely crossed. And then there's some components of the third nerve nucleus that are also crossed. And we'll come to that in the midbrain. But otherwise, we have this basic pattern of segmental structures, which there are three: sensory motor association, sensory from the neural crest, motor from the ventral quadrants of the neural tube below the sulcus limitans, and association between from the dorsal quadrants of the neural tube above the sulcus limitans. And those structures are strictly unilateral. The exception, Mike, with which?
Crossed.
Fourth nerve, part of the cross, part of the third. Okay. That's just checking for reality early in the morning at 6:35. So let's consider some of the components of the segment apparatus. You call it the answer to any question I have is 3. And it's based on the fact that there are these 3 major components to the segments, sensory motor association, which rapidly become subdivided into 3 each: 3 sensory, 3 motor, and 3 association elements. But at the segmental level, we have basic pattern of 3, and then we have the 3 suprasegmental organs, the cerebellum, collicular, and forebrain. And since they are going to be lying above anatomical functional point of view, and are connected by ascending afferents from the segments and descending efferents from the suprasegmental organs. We're going to have three types of afferents on each of the suprasegmental organs, three types of efferents. So this builds in very quickly a pattern of three. So let's take a look at a typical segment. Here we have the neural tube. And the sulcus limitans, dividing dorsal and ventral into association, and motor plates, the neural crest-derived dorsal ganglion over here, the sensory plate, and as this grows up to the adult, the easiest segment to look at is spinal cord, and what we have is an idealized segment, which is something like this. A little remnant of the neural tube, the hollow ventricle, with a little imaginary remnant of the sulcus limitans, and a dividing line, something like that, between motor and association, gray matters, and off to the side, dorsal root ganglion for the sensory plate. So let's look at the motor plate. It's divided into how many parts? Right, three. We have a medial group, a lateral group, and a dorsolateral group. The medial group of motor neurons comes out to go to axial muscles, neck, trunk, abdomen. The lateral group goes out to extremity muscles, and the dorsolateral group comes out as preganglionics, and postganglionics for the autonomic nervous system. To go to innervate eventually smooth muscles, glands, and so on. Now, having given you three anatomical sites, medial, lateral, and dorsolateral, which locations are going to persist through all the segments. We're going to look for these anatomical sites. I now have to give you another way of looking at the motor plate, because there's a major element that I've left out. It's not so well localized, and so we don't really know where to look for the cells. There's either more diffusely or smaller cells, or diffusely scattered through gray matter. But these are the change color. The small gamma efferents that come out and go to muscle spindles, the motor side of muscle spindles, which we will see are very complicated structures made up of muscle, striated at the ends, to which these gamma efferents go, and not striated in the middle, which is where the sensory spindles are. And so we have large alpha motor neurons and small gamma motor neurons, which are going to go out to muscles or muscle spindles, and the dorsolateral autonomic as that system. And so we have three places, medial, lateral, dorsolateral, and three functions: the voluntary alpha motor neuron, the sensory regulator, gamma neuron, and the autonomic. So at least those two ways of looking at the three components of motor plate. Any questions? Comments? Okay, let's look at sensory plate. Got a chair up here and got a chair over there. Sensory plate, three elements. Small, medium, and large. Got one here, Rob, and we're going to put a chair out there, and another one over here, another one there. The three sensory plate elements, small, medium, and large cells, each typically has a single process that divides peripherally and centrally directed. And if we take the small fibers first, small cells first, these go out to a fairly simple branching pre-nerve net. For pain, and enter into the segment at the periphery of the gray matter where they branch, rostral caudally, which I can't draw, they're right angles to the board. But all sensory neurons are going to do. The first thing is branch. And from those come secondary branches into what we'll see as the association plate. The medium-sized fibers go out to a variety of endings and come into the segment where they branch rostral caudally, give off secondary collaterals to the association plate that we'll come to in a moment. The large fellows, very similar, but come out to wrap around those small muscle fibers of the muscle spindle. These are the sensory spindles, and their proximal axon comes in, enters the segment, branches rostral caudally, gives off secondary collaterals to an association plate that we'll talk about very quickly. So, we have a typical segment that we're going to look at for all the spinal cord segments, all the brainstem segments up to the midbrain, through the midbrain. And we're going to look for medial, lateral, dorsolateral, motor plate elements, and or alpha and gamma motor neurons and autonomic ganglion neurons. They're right up here in the corner. And the sensory plate we're going to find in general outside of the central nervous system. The small, medium, and large cells, dorsal root ganglia, with prenerve nets, the simplest pain. The large spindle is the most complicated, and everything else in between. And those three projections into the segment will go to their particular functioning units, usually the association plate. So we've built our segment from the neural tube and neural crest, 3 elements. Each of those has 3 elements. There's 2 ways of looking at the motor plate, in terms of 3, with 3 sensory plate elements. And so now all we have to do is worry about the association plate. So any problem? There is only one segment to which this really applies. Every other segment is going to cheat. Excuse me, I'm going to have to cheat to make every other segment behave properly. Because every other segment but one is going to move the association plate someplace else. And within this particular section, the segmental apparatus will still be there, but it'll be something else, generally more rosterly placed. And so to properly appreciate the association plate elements, we're going to have to look at the third dimension of how these structures become distorted. So let me take the simplest, the small fiber system, which does have an association plate component immediately beneath the entering fibers. No. I'm just looking to see how wide the eyes are. How many components are there going to be to the association plate for the pain system?
What do you mean, how many relays?
How many cells? Relays? How many components?
Two, the relay of the thalamus and then the cortex.
Aha. I thought it was early in the morning. Not enough coffee yet. What's the answer?
I'm going to go 3 by
3, right. And what are the 3?
I don't know.
Linda? What did I say 9 years ago, Mike? Mike was a little, shall we say, complimentary perhaps, last time. He pulled out his notes from 9 years ago and said, "You said the same thing then." Now we'll test remote memory.
Are you asking what's the question again? 3 components of the association plate?
No, you can't answer a question.
Okay. Thanks, Dr.
He'd like to know what the question was before he makes up an answer. Like before I got my ears, I heard a question and didn't know what the hell the question was, so I gave an answer. That was very satisfactory for one. Anyway, the simplest system we have, basically, is the pain system. Small fibers. One of the 3 sensory plate elements. It comes into the segment and practically stays within the segment by synapsing onto cells of a nucleus, which could be called pain nucleus. Isn't usually. But it is composed of 3 elements, 3 cellular elements. Just The answer is 3. Now you just have to remember what the 3 are. And so we'll schematize here. 1, 2, 3. As a cascading down from the primary afferents through marginal. Keratinosa, and proprius cells, or in a simpler terminology, I guess it's layers 1, 2, 3, and 4, something like that. Like essentially Latin names. But each of these projects down to the next one and jumps ahead a little bit. And the last one does a number of interesting things. Comes down into the motor plate to establish connections to what kind of elements, Mike? Flexor. So when we irritate this 3-nerve net out here, with a pin, or a pain, or a burn, the temperature is also involved at the moment. Impulses come slowly in over these small fibers. Synapse, minimum of 1, 2, 3 times. Come down to flexor motor neurons, and you withdraw. Flex away from that painful stimulus. And that's all very well for touching a hot plate, or hitting your thumb with a hammer. But if you're going to do it with your foot, you better have another system built in, which comes over here. Whoops, wrong color. Comes over to the other side. So what kind of neurons, Rob? Sorry? Extensor, right. So we have an extensor neuron here. That goes out to the opposite limb. So when you flex one, you don't collapse. So here you have basically the segmental representation of the ipsilateral flexor, contralateral extensor response to pain. A polysynaptic reflex, relatively slowly conducting, but of considerable protective importance. Has anyone taken out what segment the rest of what I'm going to say applies to? All right, that's what you can think about. There's only one that's going to have flex component. T which? 1. One vote for T1. We'll approach it. Not right. We'll approach it. Let's take the large fiber system. Muscle spindle. We stretch the spindle, like that, on the knee, ankle, other tendons. Large, rapidly conducting fibers come in. Impulses come in over these large, rapidly conducting fibers. And a connection is made within the segment to a motor neuron of the same muscle. And it can be a flexor or an extensor, doesn't matter. But if we stretch that tendon, we get a rapidly conducting burst of impulses coming through, making monosynaptic reflex connection. The motor neurons are the same region. And we get back a contraction. We've stretched it, contracted, and get back to the status quo maintaining mechanism. It's a more conservative Republican type reflex path. It has another collateral that is even more important than this one for neurologists and neurosurgeons to go attack. And that is a collateral that comes in one segment. It will be in this section. It comes into the association plate. Nucleus here. It gives rise, it has cells that give rise to fibrous tissue here. And ascend as the dorsal spinocerebellar tract up to the cerebellum. And you have a name for this nucleus? Clark's nucleus. And very heavy synaptic connections between the large spindle afferents, these cells, and these large spinocerebellar tract fibers. So it's very safe, very likely to fire. And so any disturbance in the periphery, especially in any of the spindles, is going to be rapidly conducted up to the cerebellum to begin to inform the cerebellum and the rest of the nervous system what's happening in the periphery. And as soon as it gets to the cerebellum, you need that kind of information to say, I want to stop and do something else. If you don't have this system in, you don't stop, you overshoot. You come back, and if you're trying to drink a cup of coffee, it splashes all over. You can't hone in on the point you're saying anymore. You can't write as neatly as I'm writing. Okay, so this now is the beginning of where I have to give you the third dimension. Let's take a vaginal section of brainstem and spinal cord, pons, patella, cord down here, and the three hindbrain segments, the midbrain segment, and let's take any arbitrary segment, large spindle afferent, a T-shaped fellow, a peripheral branch coming from the spindle, enters into the segment, branches rostrocaudally, as we saw here, right angles to the board. 9 years ago will not have that.
We didn't have that.
You could take it this year and next year and see if I stop at the same places. But there will be collaterals within the same segment for this monosynaptic reflex. That we just talked about. The status quo maintaining mechanism. But one of the major functions is to do something else. And so here we have, if I can count my segments, 1, 2, 3, 4, 5, 6, 7. How many segments? 8. We'll get down into the thoracic area for Clark's nucleus. And the caudal branch from the cervical segments, and the rostral branch from the lumbar segments will descend or ascend into the thoracic region to end upon cells of Clark's column, from which the second neuron is going to project up the cerebellum. Tell the cerebellum what has just happened. We don't really know what this caudal branch of the lumbosacral segments does. We do know what the rostral branch of the cervical segments, the muscle spindles, does. It ascends in the posterior columns up to one of the nuclei of the posterior columns. Rob, how many nuclei in the posterior columns are there?
There's 3.
Right. Where are they?
Bacillus cumulative accessory human.
Right. Which one is this?
Pardon me?
Which one is this?
Well, that's the accessory human.
Right. And where is it in relation to the cumulative, medial or lateral?
It's lateral.
And so if we call it the lateral cumulative nucleus, life is easier to remember accessory with another name. And since we give it the name lateral cumulative, we know eventually we're going to get the cumulative nucleus and the gracile nucleus as we go from lateral to medial. And so we have what in effect is a safety factor for upper extremity information getting to the cerebellum. One element going down in the posterior columns to Clark's nucleus and the thoracic cord, and one going up in the posterior columns to the lateral cumulative nucleus and the cerebellum. And so this is the first example I'm giving you of how the segmental apparatus, which essentially is in Clark's nucleus, but it's as though you had an accordion and you just scrunched it down into the thoracic segments. But they represent all from upper cervical to the lower segment. Just collapse them. And they're very orderly represented there. If you look at the pattern.
What level did you say that was at?
Sorry?
What thoracic?
T1 to L1. And these are nice large neurons. There are maybe 4 to half a dozen in any one section that you look at. They're sitting there all by themselves, surrounded by some gray matter which doesn't have very much in it, with nerve cells. So they really catch your eye. Beyond that, if you get lost and find yourself in them, you'll think, well, this is a pretty sick spinal cord, because they look thrombolytic. They're swollen, rounded, peripherally based missile bodies. They look like thrombolytic anterior horn cells. But that's just the way God made them. That's what they look like, that's where they are. And they are an identifier of T1, 2, 3, 4 down to L1. Any problems? come to the medium-sized fibers, which also enter the dorsal roots into the dorsal column of the spinal segment. Branch, rostral quality, right angles in my board. And so if I put a medium-sized fiber here, enters into the segment, branches rostral caudally, gives off secondary collaterals to association plate elements that are scattered through the dorsal gray matter that give rise to fibers that go to the ventral spinocerebellar tract bilaterally. And these, whatever side we want to choose, coming up, I guess ventral to the dorsal one, better do that. Take this curious course I mentioned the other day, going up through the posterior middle into the anterior hindbrain segment, curving around the main sensory nucleus of 5, and coming back to the superior peduncle. These others, of course, I've gone to the inferior peduncle, cerebellum, to enter the cerebellum. And you'll recall what I said the other day, that this is essentially the second development of the cerebellum. The first being vestibular, the middle hindbrain segment, horizontal amplification of the dorsal association plate, two-way connection between the cerebellum and vestibular nucleus. This is a peculiar course dictated by the fact that we don't yet have a more advanced cerebellar system for the dorsal spinocerebellar tract and muscle spindles. We do have a lot of other sensory input, that is coordinating head, front fins, tail, fishes and things like that that are just beginning to need a lot of good coordination of their what extremities they have. And then, of course, we have another major ascending collateral here. The dorsal columns to go to the other nuclei of the posterior columns is gracilis, as we go from lateral to medial. And since these come in the lowermost segments come in and branch, running, getting pushed immediately as others get added in. So we end up with leg, the arm, as the segments added, total rostrate, new fibers come in, added in, and we get more or less laminated posterior columns with the leg going up to gracilis, the arm going up to meatus, and the muscle spindle components going up to the lateral mediate. So there's a regular pattern, a repetition of the three if you wish. way the sensory plate, medium and large fiber systems are organized in relation to their associated phase elements, rosterly placed, as a mixed bag of nuclei of the position columns. Now, any questions? Neural crest, neural tube, adult idealized segments with 3 places for motor, 3 types of sensory, and 3 types and places of association elements. And now, which section does this represent? The key is Clark's nucleus, which we've taken cervical and sacral and scrunched into thoracic. So somewhere in mid-thoracic, there's not going to be much movement. And so this section will contain the appropriate Clark's cells for the particular spindles coming in to that segment, which will be approximately T6. There's no way I'm going to get these 3 association plate elements into any section. They've been displaced way up to into the brain, above the frame of neck. So they are outside of any possibility of confusion of the segment of the section. Okay, the weekend is approaching. I've got 15 minutes left, and I probably ought to leave you with a way to remember all these segments. Forebrain up here, and midbrain, and anterior, middle, and posterior hindbrain segments. C1, 2, and so on down the line. And I'll put in an aqueduct, and a fourth ventricle, and a quick paracocci, and a cerebellum here just to fill in the cross-section, the sagittal section. Recall that we started with the primitive neural tube before any of these suprasegmental structures developed. And we had a front end and a hind end and a midbrain in between. We have 3 forebrain, midbrain, and hindbrain regions, and the spinal cord added on. Actually began back there. And those of you who've looked at the neuroanatomy courses in the past have realized there are 12 cranial nerves. And one of the major tricks of gross neuroanatomy is where the hell are they? And I'm about to give you a clue by remembering the middle hindbrain segment as the sentinel segment. That segment that hears and responds by turning the ear, those animals who have mobile ears, to focus on the sound, and turn the eye towards the sound. So that we have the eighth auditory organ anyway, the seventh motor component, and the sixth motor component, the lateral rectus, the facial muscles, and there we have the three major components of the middle hindbrain segment. It happens that they all enter or leave the segment at the junction between pons and the palate. So instead of seeing them displayed rostral caudally, before and so on, we see them 6, 7, and 8 and that lateral. This rather sharp, gross junction between the big fat belly of pons and the somewhat skinnier, flatter patella. Well, that then obviously means that if you can locate 6, 7, 8 at that point, 5 belongs up here, 9, 10, 11, 12 belong down here. Is that true, Noel? No. This is a clue now. When I ask a question like that, the clues that are attached to it. What's the catch, Rob? Not enough caffeine. Catch. Who's got the catch? 11. Right. 11 is a cervical nerve. Comes up through the frenulum and exits the others. So you don't expect to find the 11th related to the medulla except externally. So those last 4 cranial nerves, 9, 10, 11, 12, only 9, 10, and 12 are going to really push your hindbrain segmental nerves. 11 is going to be a cervical, see one before, origin, and just descending to the skull. Midbrain then has how many more? We've got 6, 7, 8, 9, 10, and 12, 11, 5, obviously 3 and 4, and 1 and 2, olfactory and visual, are going to be pieces of brain unrelated to the rest of the segmental apparatus, and so you now have all 12 cranial nerves in reasonable relationship to each other. I remembered a few attacks. I remember one major segment, the hindbrain, 6, 7, 8. The others in half fall in place. Once you remember the exceptions, olfactory visual being not like other nerves, the rhythms of the brain. And so if you followed the scheme so far, we have olfactory and visual portions of brain. The midbrain turns out to do almost everything related to the eye socket. Except for the lateral rectus. You'll see that it has all of the autonomic and all of the extraocular, voluntary muscle representations, except for lateral rectus. Now pick up down. Middle hindbrain. Anterior hindbrain can be the jaw, face, segment. Motor, jaw, sensory, face. Trigeminal. Middle hindbrain, the sentinel segment, posterior hindbrain, and mouth. Essentially everything related to the mouth, you look in the mouth and you're looking back at the posterior hindbrain. And it doesn't take much imagination to realize the cervical segments are the neck, that arm, and chest, abdomen, and so on. But you have this pile of segments related to particular parts of the body, which are very easy to see from the neck down. And include on one note here a medial-lateral, dorsolateral arrangement of motor plate. Now it's going to be a way of defining what section you're looking at. Because this lateral group of large motor neurons is only going to relate to the extremities. And the extremities are going to relate to brachial plexus, C5, 6, 7, 8, T1. And down here the leg, which is going to be what? Something like, how many segments, Rob?
L1 to
L1 to S1?
S1. Okay.
And so we're going to see these lateral neurons only in those cervical lumbar sections, not segments. The medial motor neurons are going to be everywhere. The medial face muscles of neck, chest, abdomen. The dorsolateral ones similarly are going to be very discretely placed. They're only going to be in the thoracic, T1 to L1 again, like the Parkinson piece, and the sacral component, S3, 4, 5, and scattered appropriately through brainstemsegs. So if you see a dorsolateral component, you know it's not the cervical segment. You know it's not most of the lumbar segments. If you see a dorsolateral autonomic component, you ought to see the Parkinson piece. If you see a lateral mass of anterior horn cells, the odds are against your seeing either Clark or autonomic. Now, T1? Sure. There ought to be lateral and autonomic and flutter. L1 ought to be similar. Beginning of the lateral with autonomic flutter. So there are two sections, T1 and L1, that are going to have these three components. All the other sections you look at through the spinal cord are not going to have all of those motor or association elements. They all should have nuclei marginalis, diagnosa, proprius, a small fiber system. That's one of the more primitively organized vein systems, and most closely approximates a segmental approach, segmental inflow. Spreads out over a couple segments rostral caudally, but reconcentrates down upon the final output craftily in that same segment. Dorsal root ganglia, if you look for them, you will see small, medium, and large cells. You will find dorsal root ganglia with every segment, spinal cord, except C1. And you will find the equivalent in all of the brainstem segments. So that's sort of a summary of what the segmental apparatus looks like, where it is, how it got there, and why you keep looking for threes, combinations of threes. If you make the right associations, to sort of guide you as to where you are when you look at any particular piece of brain. So for those of you who showed up yesterday, I apologize again for not having reminded you that yesterday was the second Thursday of the month. There will only be one other second Thursday, and that's in August, so we're relaxed for a month or so. We will not meet on Wednesday, but otherwise we should be meeting Monday, Tuesday, Thursday, Friday, 6:30. Any problems? Okay. The sacral elements, sensory motor elements, was not ipsilateral. The answer was the fourth nerve, which is a very curious course. Instead of coming forward like the third and every other self-respecting nerve, it goes back and crosses. A very strange course. And there are some components of the third that, although they're all coming out forward, they come from the opposite joints. But otherwise, as far as I know, all of the motor elements are ipsilateral. All of the sensory elements are ipsilateral. And all originate outside of the central nervous system. With only one exception, and that's mesencephalic trigeminal, which is a big spindle cell, a large cell, connected to spindles of jaw muscles and some extraocular muscles, and it lies inside. So there you've got, in a nutshell, the basic plan and the exceptions I know. Question, can I do?